Hi everyone, this is another 1 Minute Wednesday, and I want to take the time to talk about phase one or interceptive treatment. And now I get a lot of questions about why are kids these days having orthodontics so early? And the question is, it's a good question because it should be asked. Why is my child at 8, 9, or 10 having orthodontic treatment already? And I think there's a certain criteria that we use in the office for when we do those types of treatment. The reasons are usually, do we want to fix something now that's going to be helpful now for the bite, or to help for functioning, or help to have the patient grow in a certain way? Or do we want to do something where we do something that's going to make things easier in the future? And so those are our two criteria that we use for doing treatment at an early age. Outside of those things, if we just see crowding or we just see an overbite, it's not really necessary in most of those cases to do treatment early. So we're going to wait until middle school or older or teenage years. We have all of the permanent teeth in and then do a full assessment. But sometimes 8, 9, 10, we see an issue of crowding or lack of space or functioning, or maybe the lower jaw is having to be manipulated around teeth positions. And we think it's helpful to do treatment now to sort of set the table for later, to make orthodontics, if it's needed later on at the teenage years, it's easier because of the time we spend at that early time period. So it's early treatment, a little break, and then that kind of comprehensive treatment. And that's a criteria we use to do early treatment. So sometimes you're a candidate for it, sometimes you're not. But we like to, see those kids at that age period if the dentist deems it's necessary to kind of rule out the advantages that we might have of doing something early. So I hope that answers that question. If you have any other questions, just let us know.